I'm Dr. Ann Stevens, and I have a private practice in Fayetteville, Arkansas. I'm a clinical neuropsychologist and have been in practice for about 15 years and have been working in the neurofeedback field for around 8 years now. That's about the time I started integrating neurofeedback into my clinical practice. Yes, I currently do a lot of work. I have sort of a bimodal patient distribution. One group is traumatic brain injury. I do a lot of work with head trauma patients, a lot of work with athletes who've had concussions or concussion syndromes. And then the other large group of patients I work with are people that have some sort of developmental problem that has affected their brain functioning, like autism or attention deficit or learning disabilities, those types of things. Well, neurofeedback is a tool that I started using because it actually promotes changes in the brain to help it heal and to help it regulate better and work to remediate the issues that usually people come in and see me for. Well, that's a complicated question. One of the largest influences was that I was doing all of this assessment. You know, neuropsychologists do assessments. That's what we are trained to do. And in our community, you know, ADD was on the upswing as across the country at the time, and I was finding that I would make these diagnoses and recommend the patients go and get on medication, and either they didn't want to do that or they would come back and say it's not working. And so I started looking for alternatives. And at the same time, I was working with a group of patients in a palliative care situation who were breast cancer survivors. And they had what was termed chemo fog. And of course, they didn't want any medication, any extra medications to help with their cognitive dysfunction. And so we applied for a grant through the Komen Foundation and received it to do our initial training through EEG Spectrum. And like I said, that's been about 8 years ago now. And then that sort of jump-started me into this process. And from there, just took off. One of the primary advantages to being an affiliate is just having a group of people who use the same equipment, that you have a source to go to talk about the questions you might have and how to use this, and then the networking that this community had already set up prior to me getting involved with it. So Mike Komen was one of the instructors on my initial 4-day course. Afterwards, I had a lot more questions than I had answer to, of course, like so many people. And so then there was already a network of people to start looking at mentoring. Early on, Ed Hamlin did some of my mentoring, and then eventually Rob Coben when I did more of the coherence training and implemented into my neuropsych practice. So it was a developmental process, but you know, Spectrum was sort of the basis for all of those, the networking and the relationships that developed from that. When I first started doing neurofeedback, I hated that question because when I had to answer it, even though I knew it worked, it still sounded kind of crazy. But because of the approach that I use, I think that was really my anxiety more than the client's anxiety about it, that they were coming to me, that they already saw me as an expert. You know, they were referred by their physician or a family member or somebody that said, go see this person. And so when clients have come to see me, you know, there's already this assessment process that takes place. And we do psychological testing, for instance, or neuropsychological testing. We know how their memory's functioning compared to their language. And then we do an EEG evaluation at that time. So we are discussing when they return, before we even start the neurotherapy, how their brain is wired, what makes the deficits or the limitations that they perceive, what's sort of underlying that, measuring that compared to a normative sample. And then as I describe the process of neurofeedback and how it helps the brain regulate and teach it to sort of wire in these areas that we can see the differences from a normal population, it just fits right in with, oh, that makes perfect sense.